People can unmute themselves if they want, right?
Yeah, yeah.
Okay. Okay, good.
I haven't muted anyone, so everyone who's muted has muted themselves. So if you guys wouldn't mind muting yourselves during the presentation, just so we don't get any background noise or anything, but you're welcome to unmute if you have any questions. You can also use the chat, but I would, you're welcome to unmute yourselves if you have any questions.
Okay, so are we ready to start?
Yep.
Okay, good. I'm going to get rid of the PowerPoint presentation for right now. And I just want to welcome all of you to what's the 8th annual Medicare Open Enrollment Workshop at the Isaac Center. This is the 8th year we've been doing this. And we do it a little bit differently each year, and I just work very, very hard to make it simpler and simpler because Medicare is complicated enough as it is. So we did this last week, and we focused on the choice between original Medicare and Medicare Advantage. And this week, we're going to cover that very briefly, and then we're going to go into greater detail on how to choose a prescription drug plan and Medicare supplements or, Medigap. So what I'm going to do now is I'm going to switch over to the screen sharing so you can look at, the PowerPoint slides because there's not a lot of information in looking at me. And so here we go. And there we are. Okay. So the first thing I want everyone to know is not to worry too much about taking notes or absorbing this all. There are a lot of good resources that we're going to get to, but if you have any questions, you're welcome to contact me by email, and I will answer them directly to the extent that that's possible. So what we try to do here is just focus on the big, picture. And today we're going to cover the basic kinds of plans Medicare offers, where you get the information about these plans, how to strategize your choices, and how to save money. And again, your questions are welcome, and we'll try to end this after 40 minutes so you can ask questions. And as I said, you can also contact me, later on. And so to begin with, the biggest topic in Medicare is what you have to worry about is whether you're going to choose original Medicare or Medicare Advantage. Most of you are probably already enrolled in Medicare, and it's often the case that people are unsure exactly what kind of Medicare plan they have, and it's important to get the terminology right. So the easiest way to tell is to look at how you pay when you go to the doctor's office. If you take out that blue and white Medicare card, there's a picture of it right there, and it's a paper card when you go to the doctor. And then if you need a separate card when you go to the drugstore, you are pretty surely enrolled in original Medicare. Another way you can tell is when you're enrolled in original Medicare and you use that paper card, you don't pay any money up front when you go to the doctor, okay? If, on the other hand, when you go to the doctor, you're in Medicare Advantage, you will usually have a copay, $10 or $20 like that. you'll have the paper Medicare card because everyone, has that, but you don't use it to go to the doctor. You use a plastic card that comes from AARP, United Healthcare, or Blue Cross Blue Shield, something like that. And that plastic card is also what you use at the drugstore, okay? So if you are in original Medicare, the question is, should you consider going into Medicare Advantage and vice versa? And that's the most important choice that you're going to have to make. And so I'm just going to focus on, what the key differences are here. And you can look at the slide here, but the key differences are, I would put it this way. Original Medicare gives you more access to health care. It allows you to see more doctors and go to more hospitals. And it also allows you easier access. You never need referrals. Medicare Advantage uses networks, and you're going to have a smaller choice of doctors and hospitals. And here's the way it works. When a doctor decides he wants to be able to get paid by Medicare, he opts into Medicare, and by opting in, he agrees to see Medicare patients. And those would be patients who have the original paper card, that original Medicare card. Then if he decides he wants to be able to see, say, Blue Cross Blue Shield patients or AARP United Healthcare patients, he joins those networks, okay? So if you are in AARP United Healthcare, you have to go to one of the doctors who has agreed to take original Medicare and has also agreed to take AARP United Healthcare. However, there may be other doctors who agreed to take original Medicare but did not join AARP United Healthcare. So the way it works is every doctor who takes AARP United Healthcare also takes original Medicare, but it doesn't work the other way around. There are doctors who only take original Medicare or only some of the Medicare Advantage plans, but they do not take all of them, and some of them only take original Medicare. The same thing holds true for hospitals. It's interesting that here in New York, Memorial Sloan Kettering Cancer Hospital takes original Medicare, but they don't take any of the Medicare Advantage plans. So if you have original Medicare, you have a bigger universe of doctors because they all have to go into original Medicare, but they all don't have to go into Medicare Advantage. Now that Medicare Advantage network you're in is likely to be a local network, meaning you can only see doctors who are in the New York area. So another feature of original Medicare is that it works anywhere in the country for both doctors and hospitals, okay? Now, let's get to why this advantage is so important. I have a saying, everyone who is healthy thinks they have good health insurance because you never have to use it for anything serious. But when you're sick, especially if you have a problem condition, all of a sudden it becomes very important that you can see as many doctors as possible because you might need to see a specialist, and you want the biggest possible universe. So if you have original Medicare and you come up with a rare condition and they say to you, well, we kind of know how to take care of that, but the real experts are at the Mayo Clinic in Rochester, Minnesota. You can go out there with your Medicare card and the doctors and the hospitals will take your original Medicare there. If you have Medicare Advantage, you're going to have to go to one of the in-network hospitals in New York. So this is a main reason people choose original Medicare over Medicare Advantage. There are also no referrals. There's a second big advantage to original Medicare, which is that they don't use prior authorization. Prior authorization is a feature of, private health insurance plans where for expensive procedures like elective surgery or expensive diagnostic tests, they require your doctor to get prior approval before they will cover it. Medicare doesn't use that. So if your doctor says you need surgery, as long as it's the kind of surgery covered by Medicare, they're not going to question whether it's really necessary. But the Medicare Advantage plans can do that. Now, this is a little bit off the reservation, but if you look at, when you look at the Medicare Advantage plans, you have to realize they're businesses. Original Medicare is what you might call the public option, if you've heard that term. It's run by the government, by the Department of Health and Human Services, and they're really only accountable to the president, the Congress, and ultimately us as citizens and taxpayers. Medicare Advantage plans are funded by Original Medicare. Whatever Original Medicare thinks it costs to take care of a patient, they give it to Medicare Advantage and say, you figure it out. But Medicare Advantage plans are run by the private health insurance companies, and they are ultimately accountable to their shareholders. And so one of the ways you make money is to cut expenses. And one of the ways you can do that is through prior authorization. Basically, the insurance companies do the right thing, I would like to think, but they do have a conflict of interest, because if you're in a Medicare Advantage plan and your doctor has to get prior authorization, if there's a way for your Advantage plan to turn that down on an expensive test or procedure, they save money. Even if they don't do it, it's a conflict of interest, because the conflict is in the incentive for the company to save money at your expense. So an anecdote I can tell you is I have a friend who's a doctor, and he had a patient he was trying to get a drug approved for, and he filed for prior authorization and they didn't get an answer back. And he filed for prior authorization again, a second time with the insurance company, and they didn't get an answer back. And finally, he went back to the patient and he said, look, I'll try once more, but that's it. They're not answering me. And the patient said, well, I have a confession to make. I used to work for one of the insurance companies, and they told us when claims were submitted, just don't answer the claim the first few times, and then if they submit the claim a third time, then go ahead and answer it. So that's the kind of thing that can happen there, and you're only likely to run into it if you're really sick. But that's the other really big advantage of Original Medicare. Okay, now let's look at what the advantage of Medicare Advantage is. You have access to fewer providers, as we discussed, but there are ways you save money as compared with Original Medicare. So the first way you save money is with Original Medicare, Parts A and B, it does not include prescription drugs. You have to buy a separate prescription drug plan. This year, the cheapest premium on a prescription drug plan in New York City is less than $8. The Medicare Advantage plans, I would say, 25 to 30% of them in New York include a prescription drug plan. So you don't have to pay anything extra, and you use the same card when you go to the hospital to get your prescription drugs. They also often offer free dental insurance. It's usually minimal. It might be limited to just, cleaning your teeth, but it's there. And perhaps some free hearing, something toward hearing aids, free vision, something toward vision, a gym membership, or things like that. These are all things that you would not be able to get from original Medicare. And then finally, they have $6,700 out-of-pocket annual maximum. Actually, that's up to about $7,500 this year. So what does this mean? Out-of-pocket refers to what you have to spend of your own money for treatment under covered services. And that means if you're on Medicare Advantage and you go to the doctor and you pay $20 up front, that counts as out of pocket. And when you finally get all the way up to having spent $6,700 like that, you would have to, have a very serious problem. Then for the rest of the year, Medicare Advantage pays for the whole thing, okay? You don't have to pay for any of it. It's on Parts A and B, not your prescription drugs. Prescription drugs doesn't have a cap like, that. Original Medicare does not have that out-of-pocket cap. Original Medicare is going to, at the end of the day, have the same kind of cost sharing, but you could go up to, in a bad year, paying $10,000, $20,000, God only knows what. So it's probably not going to happen, but you don't have that protection. And what people who have original Medicare do is they usually get a Medicare supplement, which limits what you might have to pay out of pocket. Okay, so I think that where most people turn out, if money is not an object, this is in my experience, is they get original Medicare because you get access to more providers. They go ahead and buy a prescription drug plan because you have to have a prescription drug plan, and they got that they get the Medicare supplement, also known as Medigap, so they can limit their out-of-pocket expenditures. So the real question here is, for someone who might be in Medicare Advantage right now or is considering it, you might say to yourself, well, gosh, I never thought about it, that you could see all those extra doctors and hospitals if you're in original Medicare. And I might even be willing to pay a little bit extra for a prescription drug plan and maybe give up my dental benefits, but I don't like that I have to buy a Medicare supplement to limit my out-of-pocket expenses, okay? So now we're going to move on to Medicare supplements, because often that is, the decision point as to whether someone thinks they can afford original Medicare. So we're going to go down here to Medicare supplements, okay? And they're also called Medigap. There are 12 different kinds of plans. They have names like Plan A, Plan B, Plan F, so on and so forth. And if you buy the lowest cost plan in each category, your monthly premium would run anywhere from $68 to $300 a month, okay? And let's just take a look at how Medigap or Medicap supplements work. Okay. It works only with original Medicare. You can't get this if you have Medicare Advantage. And what it does is it pays your deductibles and your uh, co-insurance, what you would ordinarily pay out of pocket. And it pays either all or some of it. It doesn't cover any extra conditions. Okay, this is really important. All it does is pay what ordinarily would be your share, what you have to write a check to your doctor for or the hospital for when you get services under Medicare. Okay. And it's a very confusing area because one, Medigap is a misleading word. It connotates that there's a gap in original Medicare. There's something missing. There are people who say, well, if you have original Medicare, you got to get Medigap or a Medicare supplement policy. There is no gap in original Medicare. Every insurance, health insurance policy, including the ones you had when you were under 65, whenever you get a service, you have to pay something. That's called cost sharing. Medicare Advantage plans have that. That copay is cost sharing. If you go into the hospital, you're going to have to pay per day or the hospitalization. That's cost sharing. Original Medicare has it too. They just don't have the fixed copays. So you can definitely have original Medicare and decide you don't want to have a Medicare supplement plan. A lot of people are scared because you hear, well, the way original Medicare works is you have 20% coinsurance, and you say 20% of what? It's 20% of the approved Medicare rate, which is really, really cheap. Just ask a doctor. So if I go to see my doctor for a 15-minute office visit, the Medicare rate might be something like $75. That means Medicare pays the doctor $60 and I have to pay the doctor $15. $15 is my 25%. So it's, very hard to run up a bill of over $1,000 out of pocket during the course of a year, unless you're, seriously ill. Okay, so you're going to be able to ask questions on this. I'm not going to go into it too much in depth. It says here the advertising is misleading. You see that on the slides. The reason I put that in there is a company like AARP United Healthcare says, if you have our Medicare supplement, you never need a referral to see your doctor. It's not because you have the Medicare supplement, it's because you have original Medicare that you get that. Okay, so what they do is they set up an alternative between Medicare Advantage and Medicare supplements, but you don't have to have a Medicare supplement. Okay, now here's the important thing. When you read about Medicare supplements, how do I get rid of this? When you read about Medicare supplements, an article, say in Time Magazine or the New York Times, they're going to be written for most people who have Medicare. But there are 4 states that are different, and New York is one of them. And where New York is really different from the other 48 states is in this. In the other 48 states, you are only guaranteed the right to buy a Medigap policy within 8 months of when you turn 65. After that, if a couple of years later you decide you want to get one, the insurance company has a right to require you to get a medical exam and submit to medical underwriting. And they might put a waiting period on pre-existing conditions, or they might turn you down entirely. So that's why people are under a lot of pressure to make a decision about buying a Medigap plan when they first enroll. New York is not like that. In New York, if you have original Medicare, you can buy a Medigap supplement any day of the year. Another thing that happens in most of the other states is that the insurance companies are entitled to get you to pay more if you're older, or they might get you to, pay more if you live in an area where people have greater expenses. Not true in New York State. It costs the same amount of money for everyone. Okay, so if you're in a Medicare Advantage plan and you're saying, I'm not sure about a Medigap plan, realize that you don't have to, if you join Original Medicare, you don't have to make a decision on it right away. And definitely be aware that if you're in a Medicare Advantage plan, there's what's called Medicare Advantage enrollment period. That runs from January 1st to March 31st. And during that time, if you have Medicare Advantage, you can switch to a different Medicare Advantage plan, or you can decide to go back into original Medicare. So if you're in Medicare Advantage, you have this whole open enrollment period that ends December 7th to make a decision for next year. And then next year, the first 3 months of the year, you can make a decision to change if you want. Okay. And so when you look at these Medigap plans, what you want to do is go to page 72 of your Medicare and You handbook. And if you don't have it, you can download it at medicare.gov. And I just want to tell you, if you go to my website, Medicare 212, and you click on Get Help, you're going to see all these links where you can go to the Medicare website, download the Medicare handbook, Medicare Rights Center. It's all there. You don't have to write any of it down. But if you go to page 22, you're going to see this chart that has the various plans on it. And you're going to see on, say, A, it will pay 100% of your Medicare coinsurance. But if you skip down, it won't pay any of your skilled nursing facility care coinsurance or your Part A deductible or foreign travel or anything like that. Okay, so that's where you look at what kind of plan you might want to get there. And then there's something else you want to be able to look at, and that is a link that is on my website. You'll find it there, and you go to this website that the state of New York has, and you put in your zip code, and it shows you on the left there all the insurance companies that offer the Medicare supplement plans. And then for each column, it shows you what they each cost. Okay, and they all cover things. If you get a plan F or a plan B, what they cover is the exact same thing. It's the way it works is if you have a Medicare supplement and you go to see your doctor, you take your paper Medicare card and your Medicare supplement card, and you give both of them to them. The doctor treats you, and then they fill out a claim form to submit to Medicare. And on that form, they put your Medicare number and your Medicare supplement number. The claim goes to Medicare, and they approve it, and they pay 80% to the doctor. Now, if you didn't have a Medicare supplement, they would then send you what's called a Medicare summary notice. You would get that in any case, and then the doctor is entitled to bill you for the remaining 20%. But with a lot of the supplements, if you have a supplement, this Medicare simply sends the bill on to the supplement, and the supplement pays the other 20%. Now, I go through the procedures just so you realize there's no human brain or intelligence there. I could set up a laptop computer to, process these claims. It's very automatic. So I'm looking at my chart here for this year, and I'm looking at Plan F, and I see that if I decided I wanted to buy Plan F from Bankers Conseco, I could pay $648 a month for it. But if I buy it from United Healthcare, I could pay $308. Confusing subject, and you can answer questions about it later. But I just want to talk about two of these. Can everyone hear me? Okay. I just want to talk about two of these letter plans. The first letter plan is Plan F that I want to talk about. And that covers everything that can possibly be covered. It's the most comprehensive plan. And if you have Plan F, you never see a bill from a doctor or a hospital, because Medicare just submits the claims directly to United Healthcare or whoever your company is, and they pay it directly. Now, if you turn 65 after January 1st of this year, you cannot buy Plan F. You have to get Plan G, is the most comprehensive plan you can get. And the only difference between Plan F and Plan G is that Plan G does not cover your Part B deductible, which is $198. For all intents and purposes, they're the most comprehensive plans you can get. So one end of the spectrum, we have that. At the other end of the spectrum, we have high deductible Plan F and high deductible Plan G. And how do these plans work? Well, the way they work is they're exactly like Plan F. They cover everything, but they don't kick in until you have met the deductible, okay? And the deductible is, I'm going to have to look it up here. Gosh, it escapes my memory. It's about $2,300, a year. And so that sounds pretty terrible. But the fact of the matter is, if you look at, say, a high deductible Plan F, where you have the lowest premium of $70 a month, that's going to cost you about $800 a year. And then if you had to run through your entire deductible of $2,200, you would be up to $3,000 a year in total expenses. But your premiums on United Healthcare, which covers everything, are going to be $3,600. So you're guaranteed to save money in New York the way things fall out with high deductible Plan F as opposed to Plan F. And the same thing would go for the Plan Gs. And if you're healthy and you don't have big medical expenses, you would save even more money by doing that. And so this is what you need to look at. And I encourage you to go ahead and do it, because you stare at it and you start to get ideas. Okay, so we'll have time for questions on that. Now we're going to go to prescription drugs. There are 28 different prescription drug plans in New York City. The premiums range from $7.40 a month to, whoops, that's a typo there. That's $90 a month, okay? And what you want to do is find the drug plan that has the lowest total cost. And the way you do that is you use Medicare's Plan Finder. It's at the Medicare.gov website, okay? And you put in there all the drugs that you take regularly, and then it calculates for you what your total cost would be for the year, what the total would be of all the premium checks you write each month, and what you pay out of your wallet when you go to the drugstore, because that's really your true total cost of prescription drugs. So you go to the website, and you're going to see on the Medicare.gov page, this is what you're going to see, and you're going to see a button there that says Find 2021 Health and Drug Plans. You know what? It's really, I know how to use it, and if you stick with it, you'll figure out how it works. But for a lot of people, it's complicated. And so here's what you need to know. You can get help finding out what's the lowest prescription drug plan for you. And this is for people who have original Medicare, but if you have a Medicare Advantage plan, you can also find out an estimate of what the cheapest Medicare Advantage plan would be based on the prescription drugs that you take. So for help with prescription drugs, you can call Medicare. That's 1-800-Medicare. You can call the Medicare Rights Center, and you tell them the drugs, and they will help you. You can call HICAP. That's another typo. It's HIICAP. That's the state agency that helps people with Medicare. And then I also help people with that, but I have to charge for it if I do it individually. And you should also check with Gemma and see what the Isaac Center has going on, because in past years, if you're a member of the Isaac Center, you can work with one of the social workers, and they will take you through the Medicare website. So I want to just give you an idea of how important it is, especially if you have some people take very cheap drugs, like you can take a drug for blood pressure and cholesterol, and a lot of these plans give them to you for free. But let's say you take more expensive drugs. A couple of years ago, Consumer Reports did a study, and they wanted to see if they used Medicare Plan Finder, what the difference would be in the total cost for all these insurance policies for, say, a typical person. And so what they did was they said, okay, we're going to see how much it costs for people in Wisconsin and a few other states. And what I do each year is I take the drugs they used and I plug them in the Medicare Plan Finder, and I want to find out what the total cost would be of the prescription drug policies for someone who took these 5 drugs. There's Lipitor for cholesterol, Celebrex for pain, Cymbalta is something that's used for depression, Actos is prescribed for diabetics, and Plavix is used as a blood thinner. And if you're really interested in this, I can send you a link to a spreadsheet I did up where you can see what all these plans cost. But here's the thing. If you go into the Medicare Plan Finder and you plug in these drugs for the zip code 10128, you're going to find that the lowest cost plan is Cigna Secure Essential. It's a $24 monthly premium, and the total cost, including the premiums and the drugs, would be $569 for the year. If, however, you have AARP Saver Plus, the total cost is going to be over $3,000. $8,000 a year, in large part because the premium is so high, $80. Now, when you use Plan Finder, and I say this definitely, even if you have someone helping you, they're going to ask you what pharmacy do you use. And if you say, oh, I use King Pharmacy at 92nd and 3rd Avenue, they're going to look up the cheapest plans for King Pharmacy. But you want to put in more pharmacies than that, because there are 3 kinds of pharmacies in the Part D prescription drug plan world. There's preferred pharmacies, and if you're a preferred pharmacy for the prescription drug plan, it's going to be the lowest cost. Then there are standard pharmacies, and they're going to be more expensive, and then most expensive yet is going to be out of network. So in New York City, I certainly would always plug in Duane Reade and CVS. When you go into Plan Finder, it's going to tell you what the cheapest plan is based on the cheapest pharmacy. So you can look up and see, okay, what are the costs at the different pharmacies I listed? Be sure you use what the cheapest pharmacy is for you. That's really, really important. The second thing is that when you look at these costs, you might think that, oh, well, if I get that $90, or look at AARP, that $79 a month plan. They also have a $90 a month plan. Well, it must pay off because I must be paying for something. The fact of the matter is that when you go through these drug searches, there is no correlation between paying a higher premium and ending up with total drug costs, okay? Just because it's AARP doesn't mean it's better. AARP is actually United Healthcare, and United Healthcare pays AARP $600 million a year to use that AARP name. So really, you're best off if you look for the lowest cost. When they ask you the pharmacies, you can also tell them you want to know what the mail order pharmacy cost would be. It used to be it was lower, but it's not really, that much lower now, okay? So we're wrapping up here. So I just want to remind you, these are the phone numbers where you can get help with Medicare. You want to go to my website, medicare212.com/gethelp, and you'll find all the information there. You'll also find the websites where you can get reliable information, including that last one there that begins dfs.ny.gov, okay? That's the New York State Medicare website that has the information for the Medicare supplements that's peculiar for New York. And then finally, if you want to email me any questions, you can email me right there. So I'm going to quit now, and I'm going to turn off the screen sharing. And if you have any questions, go ahead and shoot.
Just a reminder, we do have a meeting right at 1, so don't forget his email if you want to put in the chat box if you have any questions that don't make it till 1. But if you have any questions, now is the time to ask.
Right. And don't be embarrassed to ask questions, because I've never worked with anyone who got this the first time around. When I went on Medicare a few years ago, I had to go over it 3 or 4 times to, get it. That's why those links with where you can get help are, so important.
I put my questions on the chat.
Okay, let me open up the chat here. Okay, so this is the first year you're on your Medicare, and your doctors opted out of Medicare, and you have an ophthalmologist who accepts Medicare and also requests that you pay, $20. Okay, so opt out is a technical term, and that means that the doctor has said, I'm not going to take Medicare patients. And once they do that, they can't jump back in. They're excluded for a year. So it means whether you have Medicare Advantage or Original Medicare, that doctor does not accept your insurance. And if you want to see him, you would have to pay whatever the rate is. Okay, now then there's a doctor who always requests that you pay $20. So that could be either because you have uh, Medicare Advantage, and that's the copay, probably the case, or sometimes you have doctors who are called non-participating. They participate in Medicare, but they don't participate in what's called assignment. Assignment is when what most doctors do, they agree that they will assign uh, uh, the bill to Medicare, and Medicare pays them directly instead of you. So sometimes you get that excess charge, but that's probably what you're seeing. Does that help? Does that answer help?
Yes, but what's your advice? Should I change doctors because my doctors have opted out?
Well, that's
I just want to add, I do have Blue Cross and Blue Shield as supplement.
okay. So the Blue Cross Blue Shield supplement is not going to help you. That's only going to help you with a doctor who accepts, Medicare. So the one thing I would do is, who told you that the doctor had opted out?
The doctor's office itself.
Okay, is just to make sure that, call the doctor's office and ask for the person who does the billing. A lot of people are misinformed and they use the wrong terminology, or you don't ask the question exactly right. So what you want to ask, what you want to say is, I have Original Medicare Parts A and B. Does my doctor accept that? And if they don't accept it, then if you see them directly, you're probably going to have to pay more. And so what happens is, a patient goes into the doctor and says, okay, I want to see you, but I don't have insurance. How much would it cost? And they say $300 or $400. Okay. Ask them that question, but after that say, look, I've been a patient for so many years and now I'm on Medicare. Doesn't the doctor have a special rate or a lower rate for me? And in a lot of cases, very often the doctor does, but you're not going to get it unless you ask for it. So ask for it and then see what the rate is, and then determine whether it's worth it to you to see that doctor. If you see a doctor who doesn't take Medicare, just make sure that if he orders lab tests or diagnostic tests, he's ordering from a facility that does take, Medicare. Or you could look for a new doctor who does accept Medicare. Okay, any other questions?
Yes, I put it on the chat paper about the
okay.
Medicare Advantage. I opt out of the Part D on Medicare Advantage. When originally I subscribed, they told me I was going to get any extra benefits for opting out of Part D. But right now, I don't know where I stand.
Okay. So with the Medicare Advantage plan you're on now, do you take prescription drugs?
No, I don't take any drugs.
Okay. So there are Medicare Advantage plans that do not include prescription drugs. Then I believe that you can go and buy a freestanding prescription drug plan if you want from, Medicare. But you do want to have prescription drug coverage. And the lowest.
Right now, I do not have any.
Right. So I would strongly advise you to get that for next year. Here's the problem with all of this, and I can see, we have, a few
I
more.
get the penalty because that's why I opt out of the Part D, because there was a discrepancy. Originally, I had a card from my job about medication. Then I found out it's not compatible with Medicare Advantage, the card that I had. So when I needed medication, they said I have no coverage. So I'm paying a card from my previous job, and how come? They said, oh, the computer spit it out because it was not compatible, Medicare Advantage, with that card. So they
Right.
wanted me to pay penalty.
So here's my recommendation to you is I would call the Medicare Rights Center, and I had that number up in the screen and it's on my website, but the number is 1-800
Yes.
333
333, yes.
4114. They're generally open from 10 a.m. to 3 p.m.
Oh, can I repeat it? 1-800-333-0144.
No, 800-333-4114.
Oh, I see.
And ask them
4144.
to help you in getting a prescription drug plan for next year, okay? Because you never know when today you could be totally healthy and tomorrow you could find out you need to take a prescription drug, okay? So now I have a question from someone is, how can I change back to original Medicare? Okay. The easiest way to do that is to call 1-800-MEDICARE and say, for 2021, I want to change back to original Medicare. And they will do that all for you. You'll also need to get a prescription drug plan. Actually, getting a prescription drug plan, a freestanding plan, is the way you change back. So while you're on the phone, they will help you choose a prescription drug plan based on the drugs you take. And then you can decide whether you want to get Medicare supplement or not. They really don't go into that too much, but you can decide that at a later date because there's no limited enrollment period on Medicare supplements once you have original Medicare. So you could call them January 1st when your original Medicare would begin and you would be all set. Okay, any other questions I can help you with? Okay, I'm gonna just go back to the screen sharing here and I'm gonna put those numbers back up. Okay, so in case any of you want to copy them down, these are all phone numbers where you can get person-to-person help online.
34114.
Don't wait until, December 6th to call because they're going to be very, very busy. And one piece of common sense advice is if you're talking to someone who seems confused or they're not sure of what they're talking about, make an excuse like, oh, my dog just peed on the carpet, I got to hang up. And then call back and get another person. it applies to any kind of customer service or anything like that, but it's really, really important. If you don't understand what the person is saying, especially with Medicare, where there are a lot of people and they put, temporary people on staff to handle these calls. You can call as many times as you want, and you're going to get a different person each time, and keep calling until you get someone who you feel is really taking care of your problem.
Yeah. One of the message from most doctors who opted out to Medicare is that first, Medicare rates are too low, and second, that they take a long time to reimburse them. So it would be good to send this message to Medicare as well.
Oh, they've heard it loud and clear from the doctors. And the problem here in New York is it's especially expensive to be in business, and there's a much higher percentage of doctors in New York who don't take Medicare than compared to other places in the country.
Alrighty. Sorry, we may get kicked off in a second, so everyone just make sure you take down all the information on this. Again, I will be uploading this video at the end and send it out to you by the end of the day or end of the week. So yeah, I hope you guys got good information. Thank you again, Jess, for your time. And you guys can reach out to him if you have more specific questions as you guys explore and shop around for plans.
Gemma, can you also upload the video from the last week's briefing?
I did. I sent you the link last
didn't-
week, but
Okay.
I sent you the link for the YouTube channel with all the updates. I'll send it again though, so be on the lookout.
Thank you. It
Jeff.
was very useful.
Thank you.